First slide shows the anterior view of the skull. Largest bones are frontal, parietal, zygomatic cheekbones, two maxillary bones, a single mandible. Within the nasal cavity, you will find the nasal septum, two parts, upper part perpendicular plate, bottom meets the vomer. Located on either side of the septum would be the shell-like nasal concha. Inferior nasal concha are the largest and separate bones in their own right. Superior and middle nasal concha are part of the ethmoid bone. Two nasal bones anchor the root of the nose. Within the orbits are structures that we will cover in later slides. Slide 2, lateral view. Here you could note again the larger bones and designated in red 3 out of the 4 major sutures. Coronal joins frontal to parietal, squamous, flat joins parietal to temporal. Posteriorly located is a single lambdoid suture. Within the temporal bone, you could see other structures including the external acoustic meatus, the blunt mastoid process, the sharp styloid process. Posterior view will show the other suture which joins the two parietal bones in a midline, and that is the sagittal suture. Occipital bone contains a protuberance, a bump, and a ridge known as the crest. In a mid-sagittal section, you could again see the sutures. In addition to that, sinuses, which are simply cavities in the bones, frontal and sphenoid are visible here. And again, you see the nasal septum, perpendicular plate, plus the vomer bone. Finally, in pink, you could see the two pterygoid plates, wing-like extensions of the sphenoid bone. We'll look at those later as well. Orbit. Structures associated with the orbit: superior or supra and infraorbital foramina. Fissures are elongated openings. We have a superior and an inferior orbital fissure. Designated in green would be the tear structure containing bone, a lacrimal bone, a little sliver of ethmoid right next to it. The deepest part of the orbit is all sphenoid bone. Inferior of the base of the skull, we're looking at a superior view of the inside of the skull. This is where the brain lives. Starting anteriorly, we see two other markings of the ethmoid: the crest-like crista galli sitting on the cribriform plate. The openings within the plate are the cribriform foramina, which transmit olfactory nerves, sense of smell. Again, in pink, we could see the two other sets of sphenoid wings, and the larger ones are greater, the smaller ones are the lesser. Sella turcica is this midline seat, which has a dip known as the hypophyseal fossa, which in life contains the pituitary gland. Lots of foramina to see here, from anterior to posterior optic canal, followed by the roundish foramen rotundum, then foramen ovale, oval-ish. Spinosum is a small one. Most medial, lacerated, would be the foramen lacerum. On the back of the temporal bone in this view You would see the internal acoustic meatus, which leads out from the petrous or rocky portion of the temporal bone. Posterior to that, see a pair of fairly large jugular foramina for the veins. The largest foramen, magnum, transmits the spinal cord. On either side, you would see one of the two hypoglossal canals. This is the inferior view. We're looking at it from a bird's eye view. Hard palate would be the roof of the mouth. Two maxillary, two palatine bones, little incisive fossa between the two maxillary bones up in front. Vomer, you could see as an upside down V, projects towards the front to form part of the septum. Pterygoids, the wing-like extensions, sphenoid, medial and lateral. Another couple of foramina, lacerum, we already talked about. Jugular foramina, also discussed earlier. Take your eyesight in front of the jugular, you will find the carotid canals for arteries of the same name. Here we could also see some articulation sites. Mandibular fossa forms part of the temporomandibular joint seen in the last slide. Occipital condyles articulate to first cervical vertebra, occipital condyles to C1. Once again, here within the temporal bone, you could sort of see the sharp-ish styloid processes, followed by the more blunt mastoid processes. Last slide is of the mandible. Two processes on either side, coronoid process, condylar process forms part of the temporomandibular joint, TMJ. On the interior of the mandibular rami will be one of the two mandibular foramina. Up in front in the mental or chin region would be the two mental foramina. The mandibular notches are easy to see. And then finally, alveolar processes, which form the entire alveolar margin, are structures that contain the teeth.